The Trump administration is laying off thousands of employees at the Department of Health and Human Services in what it calls a sweeping restructuring of the agency in charge of public health, food safety, and medical research. The layoffs are part of a more expansive plan by HHS Secretary Robert F. Kennedy Jr. to reorganize major programs under a new office. The effort involves slashing roughly 10,000 jobs within the department through layoffs and another 10,000 employees through early retirement and voluntary separations. The move comes after a series of executive actions by President Donald Trump, including one last week rescinding collective bargaining rights for federal health agency employees. The action impacts unionized federal workers at the CDC, FDA, and other agencies. Democrats criticized the move, arguing it jeopardizes the nation's ability to monitor disease outbreaks as well as food and medical safety, including limiting money for research and insurance programs. Under the job cuts, the FDA will lose 3,500 employees, the CDC 2,400. The National Institutes for Health will lose 1,200, and the Centers for Medicare and Medicaid Services will eliminate 300, according to HHS officials. Union officials say the cuts will impact positions in human resources, finance, IT, and others. RFK Jr. recently criticized the agency for having a sprawling bureaucracy while failing to improve Americans' health and promised to do more with less.
During the Biden administration, HHS's budget increased by 38%, and its staffing increased by 17%, but all that money has failed to improve the health of Americans. I want to promise you now that we're going to do more with less. No American is going to be left behind.
The Trump administration contends the cuts are needed to improve efficiency and argued the current size of the department has not improved health outcomes. For more on this story, download the Straight Arrow News app or go to SAN.com.